Of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
Joining us live in studio is Dr. Mark Hiatt, Executive Medical Director of Regence Blue Cross Blue Shield of Utah. It's always good to have you here, Dr. Hiatt. I want to talk first about seasonal affective disorder. The clocks have fallen back now. Days are becoming shorter and colder. So why do some of us feel worse in the late fall and the winter?
You know, Amanda, a lot of us do, in fact, feel worse in the winter, but we bounce back in the spring because of a type of depression called seasonal affective disorder.
So this is a real thing. What are some of the symptoms we're talking about?
Well, Brian, you just may not have the energy. You may feel irritable. Symptoms include changes in appetite and cravings. You may gain weight, be more irritable, anxious, have sleep abnormalities, muscle aches, difficulty concentrating, and even diminished energy. And at the very end of this all, you may develop real depression.
How many of us have this?
Amanda, it's estimated that about 5% of Americans may have this disorder called seasonal affective disorder.
So is it because of the light? What's this all really come from?
We think it's related to the light and the brain's production of a neurotransmitter called serotonin. And when the days are darker and shorter, it seems that the brain doesn't produce as much. Now, serotonin, of course, is thought to contribute to feelings of well-being and happiness.
So do we fix it just by going outside, or what's the treatment?
Yeah. That seems to be the best solution. If you're stuck inside, there is, of course, these light therapy boxes, but really the best prescription, I believe, is get outside into the sunshine and to feel that warmth.
All right, I saw this headline recently, and I wanted to ask you about this. A 3-year-old boy died after eating a grilled cheese sandwich. What in the world happened here?
Yeah. This unfortunate 3-year-old died in a preschool in New York City because he was given a grilled cheese sandwich, despite the fact that it was known that he had a very severe allergy to dairy products.
So
they knew about it.
So what went wrong here? Who didn't tell who? Lots of kids have allergies in these situations.
It was just a breakdown in their process. 2 mistakes were made. First, that this boy was given this substance to which he was allergic, and secondly, they delayed in calling 911.
Wow.
Oh, that just breaks my heart. Okay, just in brief time, are unnecessary stents being put in for heart patients? We read something about that this week.
Yes, a new study came out that's quite revolutionary in the sense that it found that there's really no benefit in patients with stable chest pain in receiving these heart stents to control their pain.
Really? It doesn't help at all?
So why are they putting them in?
Yeah, it's got to be totally contrary to what doctors are thinking and doing right now.
Well, it seems that for many years we have been doing things without really concrete substantive evidence. But here a rigorous trial was performed in which half were given these real stents and the other half were they underwent a fake stent procedure. And at the end of the study, there was no clinically important difference between the two groups.
So if you're in that group, ask your doctor
for sure.
more about that.
All right.
Well, it's always good to see you, Doctor. Thank you for teaching us so much. This portion of Utah's Morning News brought to you by Regence Blue Cross Blue Shield.